right, good evening, everyone, and welcome to ATP Live Monday. Welcome, welcome everyone to ATP Live Monday. Kindly share the video, the links, and we can start. I'm also just going to do the same to share the video and the link so that everybody can see and everybody can hear us. Welcome. So, for those who are joining us for the first time, welcome to TP Live Monday. This is a program where you get to ask any questions that you may have about the health of your children, and you will get your answers live uh, immediately. So, you're welcome. Also, I'm just going to try and share the videos to the various groups, and then we can start. So those on Instagram, you're welcome. I can see you. Welcome to ATP Live Monday. If you have any questions about the health of your children, feel free to start dropping your questions now, and then we will try and answer them as soon as we can. So just give me a couple of minutes so that I can share the videos to all the groups so that everybody can see us and they can ask their own questions as well. I hope your week has been great. We just started the week, so your day rather. I hope your day has been great. And I hope you're enjoying the weather wherever you are watching me live. Monday, the 19th of August, 6 p.m. West African time. You're welcome to ATP Live Monday. And I guess I'm almost done with my sharing and pinning. So feel free to join us now. Okay. Just a little more to share and to pin, and then we'll be good to go. So welcome. Whether you're watching on Facebook, you're watching on YouTube, or you're watching on Instagram, you're welcome to ATP Live Monday. You can start to drop your questions in the comment section, whichever platform you're watching from. Please start the question with the age of the child, and try and make your question concise and straight to the point. And then ask us very specific questions, something you want us to address. Please don't just leave information and leave it hanging, because I won't know what to do with the information. So please ask very, very specific questions. All right. I think I'm good to go now. Just one more change, and then we're good to go. All right. Oh, no. Okay. 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 Yeah. All right. I just want to pin the video, then we're good to go. Okay. All right. So yes, I'm done with all the admin stuff. Good evening, everyone. Thank you so much for everything. Thank you so much. Already I have some question on Instagram. Oh, thank you. All right, so we're going to go ahead and start to answer the questions now. Thank you so much for joining me. I'm glad you are here today. And then let's get started, because my Instagram question can disappear if I'm not fast. All right, Cherish Nyama. Is there any adverse effects of not observing tummy time for a 3 months old? There is none. You don't have to do it. It's not compulsory. It's just a kind of way of stimulating children to, to strengthen their neck control and the butt muscles and all that. But it's not like it's a thing that has to be done, or if anything is done, if it's not done, anything will happen to the child. It's okay if you don't have to do tummy time, if you don't want to do it. It's not compulsory. The most important thing is that your child is developing normally. Your child has neck control by 3 to 4 months. That's all we want. And you're also asking, how can I get my newborn to sleep better at night? Babies sleep by their own self. There's nothing you can do to get the baby to sleep. So babies go through phases of, sometimes they sleep more during the day, and then they are awake more at night. And then after a while, they are going to switch, and then they begin to sleep more during the night and be more active during the day. So it's a natural progression. You cannot force the baby to sleep at your own time. What we recommend that you sleep when your baby is sleeping, so that when your baby is awake, then you have that strength. So, but unfortunately, sometimes mothers, because you normally will be awake during the day and sleeping through the night, but when you have a new baby, you are likely going to be more uh awake at night. So that's natural. But the good news is that as the baby gets older, as they begin to become more active, then they are more active during the day, and then their sleep pattern will reverse. But there's nothing you are going to do to force the baby. Of course, you also need to do all the things to make your baby comfortable at night. So make sure you're changing the diaper. If it's wet, if it's soiled, you change it. Make sure the room is cool, it's well ventilated, it's not hot. Make sure the baby is sleeping under the nest, no bug bites. These are things that can even disturb baby sleep naturally anyway. But otherwise, baby sleep pattern is going to vary, and eventually baby will settle. So that's all we can encourage you to do for now. All right, Adejumoke. Say my 14-month-old wakes up intermittently at night every day. When you say intermittently, how long does the baby wake up for, and why is baby waking up? Is it to eat? Is it hunger? Is it wet? Is it hot? You have to figure out what is going on, why the child is waking up. Usually by this time we expect the baby to start sleeping through the night, but some babies are still sucking, so they may wake up to suck and all that. So you have to know what, you can't just say your baby wake up intermittently and just leave it like that. It won't, we can't really help without knowing why. So you have to figure out, why is my baby waking up at night? You know, is there any pattern to it? How long does baby stay awake for? And then how soon can you get baby back to sleep? And when baby sleeps, how long does it take again before the baby wakes up? You need all those kind of information, and you need to know why first, and then you try and see. So you have to make sure you have a normal sleep hygiene routine. Make sure, like I said earlier, that there are nothing that are making baby uncomfortable, like wet nappies, dirty nappies, heat, cold, all those kind of things. You have to figure those ones out, and then address the one you can address, and then that will help the baby to have a good sleep routine. Even noise and all that, those are the things you may be able to address first, and then you can now see how to support your baby. And of course, if you are doing that and your child is still struggling with sleep, then you may need to see your doctors for further evaluation. All right, so let me come back to Facebook. I think I've answered Instagram people. Um, Ojoda, let's Steven say thank you for what you do. Thank you so much for joining me, and thank you so much also for the good words. Shikodili Okpara say thank you, Dr. Gbemisola. 2016, I had my baby, and your guide made it seamless. God bless you. That's very, very nice. Thank you. Um, Peace Godwin. Say good evening, ma'am. Thank you. All right, good evening. Welcome. All right, Facebook, ask your questions. So I don't have any question yet on Facebook, just questions on Instagram. All right, Adiji Market is giving us an update. So you'll be wake up twice in the night. Okay, that's not so bad. No hunger, dresses according to weather. So when the baby wakes up, how wake up to do what? What does baby do? Is baby waking up crying? And how long does baby stay awake? And what do you normally do to get baby back to sleep? So you need to work out, and how many hours in between the sleeping does the baby wake up. If you go to our Facebook group, we have um a sleep hygiene booklet. So I will recommend you download that. It's a PDF. You can download it and you can read on sleep hygiene, how to create a good sleep hygiene for your babies and all the things you can do. It's a nice thing to start doing. You can start going through that and see things that you can learn from that. So yeah, that's what I'll recommend you can do for now. That's for the 14 months always waking up in the middle of the night. Yeah, but it's not unusual at this age. I think your main concern is maybe because you expect your baby to be sleeping all through the night by now. Yeah, but this is not unusual for a 14 months old. Is your baby still sucking, and all that. So it's them waking up twice a night. I won't worry about that, unless baby is now fully awake and now wanting to play and taking hours before settling back again into sleep. That would be otherwise. Baby waking up, maybe just breastfeed or feed, and then they go back to the sleep. That is still within normal for that particular age group, so I won't worry about that. All right. Okay, if you have any questions, please ask your questions. I don't have any question on Facebook, which is very unusual. For those on Facebook, please, if you're asking question, ask directly on the video, because if you just drop it in the group, I won't be able to see that. So let me just check that nobody's dropping their question under the video, under the group posts. You have to drop it under the video directly, otherwise we won't be able to see it. So okay, yeah, okay, I don't have any questions there. All right. Okay, let me just go back. Okay, yeah. If you just go to our Facebook group, if you know where to locate our files section on Facebook, just scroll through all the files. I think the sleep booklet is there. Or if you just search our group for sleep booklets or something like that, you'll be able to get that information, and you can just download, read it, and a lot of tips and all that on what you can do with your baby sleep. And it's okay to get them a good sleep hygiene routine started as early as possible. All right. Um, okay. So if you have any questions, Facebook people, I don't know, you're not asking questions today, which is unusual. So if you have questions, please ask your questions, and we'll try our best to answer them in the next 1 hour that we have. Um, I hope most children are on summer holidays right now, so and I hope you are keeping our children safe during these summer holidays. Um, I hope everybody's being well and healthy. Okay, so for those who are just joining us, you're welcome to ATP Live Monday, and we're here to take. It's a program where you get to ask any questions that you may have about the health of your children, and we will try and answer them in live, in 60 minutes. And I've just to remind those who may be watching the recording, and if you still have any questions after the live session, you can actually post your questions directly to our Facebook group. Our Facebook group is always open 24 7, actually 6 days a week. So Mondays to Saturdays, so it's 24/6 actually. We're not open on Sundays. Well, so Mondays to Saturday, feel free to drop your questions and we will try our best to answer them. So the live session is just for 1 hour, but if you have questions after we are off, you are welcome to post your questions and we will answer them. All right. I got a question on Facebook now. Okay, how do I need help on how to potty train my 3-year-olds during the night? Okay, what do you mean by potty train during the night? So if I understand the question, you meant the child is able to use the toilet during the day, and then maybe at night is it bedwetting or soiling? We need to have, because we don't usually talk of potty training as far as night is concerned. Okay, so usually, because when you see somebody is potty training, you need the person is able to wake up, the person is able to go to the toilet on their own, or use the potty on their own, and all that. Usually you do that during the day. So most children, during the sleep, they sleep through the night. At some age, they're unable to wake up to go pee in the toilet, so which is still developmentally appropriate at age of 3. Yeah, if you mean bedwetting, we don't technically talk of bedwetting until the age of 5. So a 3-year-old is still allowed, to not to be able to wake up to sleep. I mean, to not to be dry at night. So that is still age appropriate. So what we normally recommend is that before your child goes to bed, you try and encourage them to pee, before going to bed. You try and make them to drink water during the day and not at night. Once it's like 6 7 p.m., you want to stop them drinking water, and then they go and pee before they go to bed and all that. So that's what you can do until they on their own. Therefore, now you just have to wear them either pull-ups or nappies at night. Then hopefully as they get older, they're able to control their bladder better, and some of them will now begin to wake up on their own, to go and use the toilet at night, or they're able to keep the urine in their bladder until they wake up in the morning and then they go pee. So, but we will not be worried about that until they are 5. So usually it's at the age of 5 we start calling it bedwetting, and that's when we start to think, is there something going on with this child that is, and can we do something about it? But before that age of 5, we still count it as developmentally appropriate. So all you can do is just to kind of support the child. Like I said, make sure they drink a lot of water during the day. Avoid them taking tea or caffeine or things like that at night. Unfortunately, that's what most people do. But actually, that is wrong, because those kind of things irritate the bladder and it helps children to bedwet. So any of those kind of drinks, it has to be during the day. And by 6 7, you want to stop all the drinking, and then make sure they go and use a bathroom, if possible, twice. So before they go to sleep finally at night. Some parents do wake up their children in the middle of the night to go and pee and all that, but we don't tend to recommend that because it tends to disrupt their sleep, which is actually not the best for the children. So yeah, but sometimes some parents do that as well. But as they get older, it tends to get better. So, and then they are more alert. However, some children may actually have their own difficulties. Some children are deep sleepers, so they don't tend to wake up. Some children have difficulty concentrating their urine and all that. So we can manage that. There are medications, there are strategies like bedwetting alarms and all that that we use, but we don't start doing all that or start doing any form of intervention, or call it bedwetting until the age of 5. So before the age of 5, I wouldn't worry about it. I would just take it as still developmentally normal and appropriate. So there's no reason to worry. For a 3-year-old, as long as they're able to go to toilet by themselves and they are dry during the day, that is enough for us, and we wouldn't worry about it. So I hope that is helpful. But if you need help with potty training during the day, we have an article on our website, information on our Facebook group as well on tips on potty training and all that, which you can get additional information from. So I hope that's helpful for Obianuju. Yeah, Igwe. Okay. So I hope that's helpful. But for those who are listening, if your child is older than 5 and they are struggling with bedwetting, most of us think it's something that we should shame the children for, or we should beat them for and all that. No, it's not. It can actually be a medical issue for some children. And there are approaches, there are treatments. So it's not by shaming the child or beating them that we're going to get them dry. We actually, some children actually need help, and it's actually one of those conditions that we can actually treat as well. So if your 5-year-old is bedwetting, or even some I've seen 10-year-olds and all that, feel free to see your pediatrician. Uh, if you are not sure which pediatrician to see, you can see them in the teaching hospital, and then they'll be able to give you appropriate intervention. All right. Okay, I'm going to just say thank you, doctor. Your response. Okay, I'm glad to be of service. All right, today's a slow day. We don't have questions today. All right, so if you have questions, remember to ask your questions. And of course, you're always free to post your questions also on our live section. I mean, on our Facebook group after the live section, and we'll also try and answer them as well. All right, great. Also, if you want to know more about any particular topic, like you want us to discuss a particular topic, you are welcome to also post that also on our Facebook group and say, can you talk more about this particular topic? Though there are so many topics I'm sure we've talked about, so you can always check all the past videos. If you check our past videos, you will see those questions, those topics that we've talked about, virtually all the big topics in pediatrics that has to do with children health. We have talked about them. So I encourage you to watch all the past videos as well. And if you are the type that you like to listen rather than watch, you can check out our podcast as well. We have lots of things. We've talked about fever, pneumonia, asthma, autism, ADHD, all sorts of topics. You can also check out on the podcast or on our YouTube channel, ATP TV. And if you're the type that likes to read, you can also read on our website. Website is undergoing some upgrading right now, but I'm sure by the end of the week it should be back up. So you can also check our website to read more on those topics. And sometimes some of our questions we have actually answered them. So some people actually do that. They just go to our Facebook group, type in the question in the search button, and then they can get the answers straight away without even waiting for us. But if you are not sure, you don't know the answer, of course, you're welcome to just type it fresh, and we'll try our best to answer your question within 24 to 48 hours. We'll try and answer your questions for you. So that's what we do on ATP. All right. And of course, on Thursday, we try to do our ATP hour. I know we've not been consistent right now, but we'll hopefully go back to being consistent. So feel free to also watch. That is our teaching session on Thursday, 10 a.m. But on Monday, like this, that's when we do our free Q&A section. All right. So I'm just waiting for anybody that have a question to ask. All right. I can't see so many questions. I guess people not having any issues, which is okay. We also don't always want these people to have issues, so it's okay not to have any questions. But just to remind us, I think the beginning of the month we started with our breastfeeding week, so I believe all of us are aware of breastfeeding. So let's make sure we are breastfeeding our children, exclusive for the first 6 months, and after that we start the complementary feeding and we breastfeed for as long as possible. Some people I say when we say 2 years and beyond, it's up to you really, but we recommend minimum of 2 years. And let's remember to take our children for their immunizations, and let's remember that immunization no longer ends at 9 months. Okay, I know that before it was 9 months. Now we went further to make it 15 months, and now we're actually doing HPV immunization, which is now going up to 9 years. So immunization keep expanding all the time, and they are free. You don't have to pay for any of those immunization. Feel free to go into your health centers and get them. And if your children have missed any of the immunization, you can catch up on some of them. Some of them may not be necessary anymore, but some are still necessary. So feel free to catch up on any missed immunization that your children may have missed. You are welcome to um, catch up. It's really things like BCG, things like hepatitis, things like pneumococcal vaccine. These are conditions that can still affect people even as adults. So it's always good to catch up on our immunization for our children and for our girls especially. Please, the human papilloma virus HPV vaccine is very important. I think recently we see heard of a very popular person who died from cervical cancer. So cervical cancer is one of the top two cancers in women. uh, breast cancer, cervical cancer. And the good thing about cervical cancer is that it is preventable, really, because 99% of cervical cancer, maybe 95%, has something to do with human papilloma virus. So HPV is linked, with cervical cancer. So if we can prevent HPV infection, we will be able to prevent cervical cancer indirectly. So which is why the Nigerian government now has introduced the HPV vaccine. So please, let's take our daughters, especially it's for boys and girls. Let's take them for HPV vaccine. I've seen a lot of terrible misinformation online. It is not meant to uh, um, no, it's not meant to reduce the population. It's not meant to cause any harm to our children. It's actually help to prevent cervical cancer. So let's ensure. And for those of us who are, even for those of us who are older women, please, if you're having babies, if you are women of a childbearing age, please do your pap smear. Every 3 years. And then make sure you're checking it so that if they notice any abnormal cells, they can quickly, cure it, because when we pick it up early, we can actually remove it and the person will be cured. But once it has spread and it has become stage 3, stage 4, that is almost a death sentence. So, but we can even prevent it further down by giving our children the HPV vaccine. The adults can also take HPV vaccine if you have not taken it as well. But I'm not sure whether the government is giving adults for free, but I'm sure they are giving the children for free. All right, so that is just free information that I'm sharing with us. So if you still have questions, feel free to ask your questions. I'm here till 7 p.m. West African time. So feel free to ask your questions. For those who are just joining and wondering what is going on today on ATP Live, I'm here to answer any questions that you may have about the health of your children. So feel free to ask your questions now, and I will try my best to answer them. I still got another half hour to go, so there is time. I know that people tend to ask me questions uh, uh, after towards the end when we're rushing. So, but it's okay. So, but I'm here now, so feel free to ask your questions. Okay, I'm checking on Instagram, I'm checking on Facebook, and making sure there's anybody that have a question, we can answer them. Da, da, da. People, before we normally stream to our Facebook group, but Facebook has stopped that right now, so we can only share the link to our Facebook group. We cannot stream directly to the Facebook group. So I guess that is also partly why those on the Facebook group may not be able to see the video directly. So okay. Okay, I can see somebody is asking questions on our Facebook group, which is a challenge I know people may have. Um, yeah, asking on the group instead on the page. Okay. The question the person is asking, which I'm not sure she's able to hear me now answering it, is the fact that is there any problem with a woman taking tetanus injection in procedure for life instead of taking it only when pregnant? Okay, that's a very important question. You don't have to take your tetanus injection only when you're pregnant. There is a strategy for taking your tetanus injection, and it is five five doses. So once you take the 5 doses, you have taken it for life. It's just that it's easier for people to remember during the pregnancy. And the reason why we actually give you tetanus is not actually it's not really for those of us as pediatricians, it's not really about you as a mother, to be honest. We're actually giving you your injection more from the perspective of the baby. So we are a little bit selfish in that response, so that when we give mothers tetanus immunization, even though you are also benefiting and you are protected against, if you have wounds, you won't have tetanus yourself. But we are more concerned about the baby having what we call neonatal tetanus. Our goal is to make sure we eradicate neonatal tetanus. And I think we're doing so well right now. Before, when I was training as a doctor, I mean, we have a lot of babies who have tetanus because these babies have been born in the home of what we call traditional birth attendants, and they have cut their cord with the same scissors for everybody. They've applied cow dung, all those things, and so tetanus is, and you see these babies going, stiff and having spasm, and we tend to lose a lot of those babies. But we find out that if we can get the mothers to be immunized, then the mothers will pass on the antibodies to the babies, so the babies will not have tetanus. And of course, in addition to making sure we deliver babies in hygienic sterile environments, so we give the tetanus immunization to mothers, primarily to actually protect their babies from having what we call neonatal tetanus, but the mother is also protected in the process. So there are two options for taking your 5 doses. For each pregnancy, we give you 2 doses. So every pregnancy you take 2 doses, and hopefully by the time you go through 3 or 4 pregnancies, you will be done with all your 5 doses. But if you don't want to wait until you're pregnant to take your tetanus immunization, you can just take it. So the first one, if you take it today, that will be 0. 6 months later, you can take your second dose. Sorry, 1 month later, you take your second dose. 6 months later, you take your third dose. Then a year after, you take your fourth dose, and a year after, you take your fifth dose. And that ideally should protect you for life, so each of the doses, your protection goes higher and higher. I think by the fourth dose you're protected for 10 years, and by the time you take the fifth dose you're protected for life. So it is not compulsory for you to take it when you're pregnant. You can just take it, 0, 1, 6 months, 1 year, 1 year. But if you forgot, if you are following the 5 year, the one that you take on your own without getting pregnant, if you forgot, that's still also fine. When you're pregnant again, we can just resume it, because some others wonder whether, does that mean they will have to start all over again? No, you don't start all over again. You will just continue from where you stopped. So that is how we do the tetanus immunization. So it is perfectly okay for you to do it the way that is convenient for you. But for us, because we know that we can always get parents, get the mothers during pregnancy, because when you're pregnant, people come for their antenatal clinic, and so because they are coming for antenatal clinic, so that is the easiest way for us to catch mothers. So that's when we do the tetanus immunization. And I've seen people, I remember when I was in South Africa, it is not every country that that does that. So for those of you who have traveled outside the country and you've noticed that they don't give you your tetanus, because some mothers ask like, how come they're not giving me tetanus immunization? Some country don't do that because they are so sure that their mothers are going to deliver in the hospitals anyway, and the hospitals, they are very sure of their hygiene process. So if we follow hygiene, and we follow this normal sterile process of delivering a baby, tetanus should not be an issue at all. So, but because in Nigeria, most of our mothers will not even, some don't deliver in the hospitals, and some will not deliver in an hygienic environment. Maybe they go to deliver, even some so-called hospitals may not be following the proper sterile way of delivering a baby. So we are not sure. And so we have a lot of problem with neonatal tetanus, and that is why we have to give our mothers tetanus immunization. But for countries where they don't have that kind of issue, then they don't worry at all. Okay, I have a question on Instagram now. Queen Bond say, good evening. What is the ideal weight of a baby that weighs 4.3 kg at birth at 6 months? The ideal weight is usually so usually the rule of the thumb, we say that 6 months baby should double their birth weights, and then they should triple. But when we say that for babies that have normal birth weights. Okay, so babies between 2.5 and less than 4 kilos and all that. So this baby was already a big baby at birth. I'm not quite sure why the baby was born big. That's maybe important to know. So we cannot say we got your baby double, that will be 8.6, and that is still big as well. But we want your baby to have normal weight. But so for some babies that were born big, maybe because their mother have diabetes and all that, sometimes they can stop because the effect of the mother's hormones are no longer there, so they go back to normal weights. So for a 6 month old weighing at least 7.5 will be okay. So average 6 month old should weigh 7.5 kilos, and by the time they are 1 year old, we want them to weigh 10 kg. So if you're a queen born, I hope you're listening. If your baby is weighing like 7.5, I'll be happy with that. But if your baby was already big and your baby is now weighing by like 8.6, that is still okay. It is because your baby was already big. But usually for big babies, we always want to know why. So it would be nice for you to have a conversation with your pediatrician. Like for example, in some families, they're always big, so the babies are big as well. So whereas for some, there may be a sign of a medical problem, like some syndromes, and that make babies to be very big. So you can have that conversation with your pediatrician. But what we don't want is the baby now becoming too small, or not even gaining much weight in 6 months, then that will be worrisome. And usually at 6 months, we hope you exclusive breastfeed your baby for the first 6 months. After 6 months, breast milk is no longer going to be enough. So please make sure you start your child on complementary feeding, giving her that solid while you continue to breastfeed as well. And usually for babies that are big as well, as they begin, when they start to sit and they start to crawl, some of them will lose some of those baby fats and go back to what is the normal or average weight for babies. So let us know what is the weight of your baby now, Queen Born, if you are still listening. I think that's more important to know what is your current baby's weight, and then we can tell you what to do about that. So I hope that's helpful. I hope there's no reason why we're not getting Facebook comments or questions. All right. So we see here. If you have any questions, feel free to post your questions, to ask your questions. And if you are watching this as a recording after we're no longer live, that is also not a problem. But please make sure that you go to our Facebook group and you can post your questions there from Mondays to Saturdays. That is how we'll do it. That's how we can support you. All right. Uh, okay. Say a sign of what? I'm not sure which sign of which part. Which part of my questions were you saying? Like, it was baby big or what? Okay, your baby is 8.2. So 8.2 is not bad for your baby. That's fine. Yeah, that's okay. I just said that, did you know why your baby was born so big? Did your doctors have an explanation? So if they have an explanation for you on why your baby was big, that is okay. All right. So for example, some babies are born big because the mother has diabetes when pregnant, or mom sometimes we hit a lot as well. Or maybe in some family they tend to have big babies, all the babies are big. But sometimes in some children it may be a sign of a medical condition, like some endocrine conditions and all that. Babies are big and it gives us information. So the most important thing is for us to know why the baby was big. And if we don't know why, and your baby's weight is not that too the increase in weight is not too worrisome. We'll just keep an eye on it. I won't worry. So, but 8.2, you've given me your baby's current weight of 8.2. I will not worry about it. Okay, no explanation. Yeah, that's okay, fine. Just keep an eye on it. You can now start to give your baby complementary food and keep breastfeeding as well. And let your doctors monitor you. But I will expect that they would have done um, diabetes test for you in pregnancy or later. So you may still want them to check yourself that you're not diabetic and all that, and whether it tends to run in your family. So, but don't worry about that. All right. Okay, I got a question finally on Facebook. All right, Titi. Titi. Is it Titi? Okay. Anyway, my circumcision is about 3 weeks old. Who is circumcised? Is it your baby or yourself? Because that's is important to know. Because I think something is missing your question. I want to assume maybe it's your son's circumcision. It's totally healed, but I refuse to darken. Just leave it alone. You don't have to panic or worry about that. So if there's no raw area in the circumcision area, that is absolutely fine. The most important thing is that there's no wound, there's no infection, there's no pus coming out, there's no nothing coming out. So I won't worry so much about that. So the darkening process will happen over time. I'm not sure why you worry about darkness, but I guess maybe your child is dark skinned and you think you should maintain the normal color of the rest of the body. If that is the situation, there's no reason to worry about that. Just keep an eye on it for now. So that's what I will say about that. And I strongly hope you're referring to circumcision of a boy, because we don't recommend female circumcision. But I want to believe. Feel free to updates if there's any change. Confidence, can you give you example of syndromes that make babies to put on excessive weight? I can give you an example, but I don't think it's going to it's going to make much meaning to you. Okay, so there are different kind of syndromes. We have Beckett-Wiedemann syndrome. We have Angelman syndrome. There are different kind of syndromes, but it's not relevant to you. It's more for the professionals who is seeing your child. But there are other things that we will see in that child apart from the weight gain. So it won't just be only the weight. So there will be other signs. For example, the first one I mentioned, those children also tend to have umbilical hernia. They tend to have one side of the body bigger than the other. So there are other things that the doctors will see in those babies before they make those diagnoses. So it is part, but that is why it's important that a doctor, at least a pediatrician, sees those babies, because if not, we will miss them. In fact, in some places, they actually screen their children. They do what we call newborn screening for some of these conditions, but we don't do that in Nigeria. We don't have the facility. But there are things the doctors will say. It's the reason why every doctor has to be every child has to be examined by a doctor before they are discharged, so that if there are little signs that we need to see, we can pick it up. But sometimes some babies are born in hospitals with no pediatricians. On the general doctor, sometimes they are just focused on the fact that you've had your baby, you are fine, your baby is fine. But usually for us as pediatricians, we actually examine all the newborn babies. We count the fingers, we count the toes, we check for the testes, whether they are present in the scrotum. We feel the tummy. We have to check every part of them, so that if there are anything in the heart, in any other part of the body, or even in addition to the size of the baby, we can begin to work out, is there something that we need to worry about? Most of these things are not common, they are rare stuff, but that's the only way we will pick them up. So I don't want you guys to start panicking about, if your baby was born big. The most important thing is that just make sure you see a pediatrician. Like the other person asking the question said, most of the time there's nothing wrong with the baby. It's either that maybe the mom has diabetes, or they are big in the family, or the mom was eating too much during pregnancy. But sometimes, once in a while, it may be a sign of something different. But there will be other things that will help us to figure it out. All right, I hope that is reassuring for you. Confidence. TTT is okay. Yeah, it was your son's circumcision. Yeah, I'm relieved to hear that, because I know some people still circumcise the female child, which we are saying no. Please, the only people that can be circumcised are the boys and not the girls. So that is very important to us. It's actually a criminal offense to circumcise girls. In countries like the UK, for example, you'll be arrested by the police. And even if you take your children to Nigeria to do it and come back to the UK, you can still get into trouble with the law. All right. Queen Born, say my baby does not like milk. What do you do? What do you mean your baby does not like? Your baby is 6 months old, so your baby is 6 months old should be on breast milk, and you're just about to start complementary feeding. So when you say your baby does not like milk, are you referring to that your baby does not like breast milk? Okay, I need to have that clarity on that. That is number one. Number two, your baby should now go on complementary food, and there are multiple options that you can give. All the different food that you have in your kitchen, you can give to your baby. It's just the way you process it, the texture and all that will be different. So you can keep giving your baby breast milk in addition to the complementary food. So I'm not really quite sure what you meant by your baby does not like. If you're talking about formula, it's not compulsory for your baby to take formula. Your baby can just take the breast milk only, and with the complementary food, and that will still be okay. So complementary food is not formula feeding. A lot of mothers think, okay, when we say it's time for complementary food, it means that they drop breast milk and they start to give formula. That is not true, actually. You don't have to stop breastfeeding. In fact, you should not stop breastfeeding. You should keep breastfeeding, but you don't have to give your babies formula when you start complementary food. It's not formula feeding. Complementary food is giving your baby solid food in addition to breast milk. So any of the food, your different classes of food, your potato, your yam, your rice, your cereals, your protein like your meats and your fish and your egg, and plant protein, your coconut, your groundnuts, your beans and all that. They are all food that you can give your fat and oil, your fruits, your veggies, in addition, you can give milk, but it doesn't have to be formula. It can just be your breast milk. So you don't have to give your baby formula, because yeah, some babies don't tolerate the formula because the formula are made from cow milk, and so maybe it's actually have what we call cow milk allergy. So as long as you can breastfeed, it is not compulsory for you to give your child a formula, any of this formula. So if you are giving the formula, your child is throwing it up, then just stop the formula and just give your breast milk only. That's all. So that's all you need to do. I hope that's helpful for you. All right. Yeah, you said non-milk. Okay, yeah, it's not compulsory for everybody to take any of the formulas. Just keep giving your breast milk, and then you give your complementary food. If you need more information on complementary feeding, you can go to our Facebook group. We have a guide section under the menu. There's what we call guides. If you go to the guide section, there's guide 2, and guide 2 is all about infant feeding, complementary feeding. There are about 5 or 6 videos for you to watch on what do I give my baby, how often do I feed my baby, all those very short, very simple, and very straightforward videos. And you will see on those videos, you will never see them use any nan or any of the formulas. You will never see them use anything from the can. It's all going to be food you have in your kitchen, and of course you keep breastfeeding. That's all you need to give your baby after 6 months. You don't need to give them any particular formula at all. I know, yeah, just to reassure you about that. All right, so we're wrapping up right now. Going to round up in a few minutes. But like I said, if you have any questions after we have gone off live, feel free to post your questions to our Facebook group, and we will try our best to answer your questions Mondays to Saturdays. All right, but otherwise, um, um, we always say Mondays is for live question and answers, just 1 hour. But after that, we will be there to answer your question as well. So that is how it is. Okay. So thank you to those of you who have been here today, and for those who have asked so many questions. Coin Bond, thank you for joining us, and those TT and Confidence and the rest on Facebook. Thank you for staying close and asking your questions. Yeah, if you are coming on live, I know many people are just coming back from work, trying to join us. No worries. Thank you so much for if you're just joining us. You can watch the video just in case somebody has asked that question that you have in your mind. And then if unfortunately nobody has asked your questions and you don't have the answer to your question from the broadcast, yes, just head over to our Facebook group, post your questions there, and we will try our best to answer it in 24 to 48 hours. That's what we try to do. Sometimes maybe up to 72 hours. Just full disclosure, it depends on how complex your question is. So for free, straightforward questions, people can answer it quickly, but for things that are a little bit more technical, you may have to wait until we have the right specialists come online to answer your question. But just be patient, we would definitely answer your questions. And of course, if it's an emergency, please don't uh, wait on Facebook. If you have an emergency, you have to go to hospital immediately, and then we will be there to sort you out in the hospital. All right, so I hope that's helpful. All right. So I think since we don't have any question, I'm just going to close the session right now. Thank you so much for watching, and have a wonderful, wonderful evening. Bye bye.